Good morning.
Good morning, everyone. Welcome. We'll give folks just a couple more minutes to join us before we get started, but we will start with our meet and greet breakout rooms as we've been doing. And I don't see Kathy online yet.
Good morning. I just want to test my audio. Can other people hear me?
Yes, Molly, we've got you.
I cannot hear you, Kayla. That was what I wanted to test.
Okay.
Thank you. I'm going to leave and come back.
Okay. I don't see Adam on yet either. Here comes Kathy.
Hello?
Hello.
Okay, I hear you. Thank you.
Great. Thanks, Molly.
Hi all. Sorry, my camera does not seem to be working. But this is Kathy Coming Del Rio. I am the Advocacy and Programs Director at Mean Equal Justice. I use she, her pronouns, and I chair the MAC. I'll try to figure out what's going on with my camera. Um, but welcome, folks. And we, oh, sorry, hold on a second. Okay. Um, Kayla, should I pass it over to you to do the breakouts for the introductions?
Sure. Yes. I am about to open our breakout rooms, and it will pull you all into small groups, about 3 or 4 folks per group. Please share your name, pronouns, what organization or what role you represent in the MAC today. And then please share one exciting plan on your horizon. It may be a vacation, it may be something at work, whatever is making you feel excited about something coming up. So I will go ahead and open all of the rooms and get folks assigned. It looks like only 3 folks got pulled, so I'm going to start that over. And we'll have about 5 minutes in your room just for awareness. It's about less than a minute per person. Are folks seeing rooms pop up? No. Okay.
My Zoom has also been very wonky since giving testimony at the State House. So if mine doesn't work, it might just be because I broke Zoom.
Oh. All right, Rachel, I hope not. There we go.
Kayla,
Hi.
some PCGers are on the call and we got put into rooms. Do you want us to join those or would
Yeah,
you? Okay.
I would say go for it and meet folks and say hello. That's fine. Up to
Okay.
you. If you don't feel comfortable, that's okay too.
Either way is fine. Just wasn't sure what you wanted from us.
Thank you. Hi, Michelle. Hi, Laura. Are you both automatically seeing breakout rooms to join now that you've joined the MAC? We're doing the breakout meet and greet.
No, I'm not.
To be assigned.
Okay.
But Kayla, can you not assign me because I need to look at what you just gave me?
Yes, no problem.
Thank you.
Hi, everyone. Welcome back.
Hi everyone, welcome. I am still having problems with my camera, clearly, because of a black spot. But again, for those who just joined, my name is Kathy Cohen Del Rio. I use she, her pronouns. I'm the Advocacy and Programs Director at Mean Equal Justice and chair the MAC. Thanks for doing those quick introductions. And now we're going to pass it over to Michelle Probert to share updates from MaineCare.
Great. Thank you, Kathy. Good morning, everybody. My name is Michelle Probert. I use she, her pronouns, and I'm the director for the Office of MaineCare Services. Thank you for joining us this morning. First, I wanted to talk a bit about emergency and proposed rulemaking around sections 13, 28, 97, as well as new global rule, section 65 and section 97. First, I will acknowledge that these are important rulemakings to members, to families, to providers, and to the department. We just want to acknowledge that the timing of information has not been ideal, and that has been for a number of reasons, including that It took a lot of folks at the department and with the Office of the Attorney General working up until the last moment to make sure that we could proceed with rulemaking and comply with the settlement agreement with the Department of Justice. And so, for example, when we had our last MAC meeting, I think it was on January 6th, we did not know for certain at that time whether we would be taking the path of proceeding with emergency rulemaking followed by proposed rules. And so we did not have that information available to share or discuss at our last meeting. Just in terms of using this meeting as an opportunity to discuss rules. As a reminder, we provide updates to this group in our rulemaking packet prior to each meeting. We put items in that packet that we are confident and comfortable that are moving forward. And we've tried to change the format of that packet as well as these meetings to create more space for engagement. And so where there are items where you know ahead of time that you would like more discussion, flagging that ahead of an agenda is helpful. And I understand that that is not always possible. And sometimes it is actions by the department that that create the need for more discussion, and that timing might not always work out. But just as a reminder, we do please ask that you review those packets so that when possible, we can get items on the agenda for more in-depth discussion. And so absent our ability to discuss these rules at our last MAC meeting, we did, as a department, provide an update on January 30th regarding the emergency rules. And that was the same day that the emergency rules went live. I will also acknowledge that as these things go, of course, we ended up having a snowstorm and a state closure on the day when a number of hearings for proposed rules were planning to happen. And so this was a difficult decision because on one hand, the way that we advertise these hearings, we don't ask for pre-registration. They are published in the newspaper. And so we were concerned about individuals, that if we canceled the hearings, individuals would show up and understandably be upset that there was no hearing. We also know that it is not uncommon for the state to cancel things when there are snowstorms. And so there might have been a perception that there wouldn't be a hearing. And then also we had concerns about potential lapsing of rules. So we made the difficult decision to proceed with having those hearings, but we set up a second round of the hearings and extended our comment deadline to try to make sure that individuals who did not have the opportunity to share their comments at the first hearing would still be able to participate in hearing structure and provide that feedback to the department. I do want to remind folks that because we continue to get feedback, but we really want to make sure that folks are officially submitting their feedback as comments. Sometimes if something goes to a commissioner or to me, but it's not going to the contact for comments and it's not stated that this is a comment, we want to make sure that we are capturing and considering all of the feedback regarding these rules. So please just make sure that you are submitting those comments through the formal pathway. And Kristen, if you want to put in the chat, I think that the contact for this rule is Henry Eckerson, but if you could let folks know proper avenues for commenting, that would be very helpful. And just as a reminder, because 13, 28, and 97 are proposed right now. We are not able to have substantive discussion about those proposed rules at this meeting or in general right now because of the current status. And we have been working hard within the department as well as with interested parties to make sure that we're trying to clarify provisions of emergency rules that are now in place so that we can ensure compliance with those provisions and details that aren't in rule about how that is being operationalized.
Michelle, I see that Rachel has a question in the chat, but just in terms of the rulemaking process, I do recognize that like how public hearings and comment periods are announced is broader than just MaineCare or just DHHS. But I wonder if like some internal conversation could happen with the appropriate parties about like maybe there's like a note that can go in the paper that says like in the event of a snowstorm this will be rescheduled, or an event of a state office closure this will be rescheduled, because I do think that most people who work with the state assume that state offices are closed means meetings aren't happening, since that is usually what happens. So I can totally understand why there was so much confusion. And then I guess my other question was in terms of the process, and I don't watch this section of policy closely, so it didn't register for me for the January meeting, but even in the event where I can understand sometimes that there are policies that may be getting drafted that aren't yet ready to be put in the rulemaking packet before a MAC meeting, but was this flat? I guess it's hard for people to come to the MAC meeting prepared to talk about something if they don't know that something's going to get proposed after the MAC meeting. So like it would be helpful if there's some way to flag that. And I know we changed our process for how we do the rulemaking packet as part of the MAC meeting. And so that might be something we have to talk about more, but just to make sure that there's still that opportunity for someone from policy to say like, you know, this isn't in the rulemaking packet, but we are working on rules related to these sections of policy because of this federal need or whatever the reason is. So just something I think for us at the MAC, but also for you, hopefully at the department, to think some more about.
Thanks, Kathy. That's very reasonable feedback, and hear you on that. We'll take back the suggestion around, calling out snowstorms, as well as what we can do in that packet to flag things that we are working on. Perhaps even as in with this case, if it is not quite settled at the time of the MAC, exactly what our approach or timing will be. And again, recognize that the timing communications were not ideal. And part of that was related to a lot of decisions that needed to be made later in the game with these rules. But we will take back the feedback and think about how we can make sure that we're being communicative and giving a heads up about discussions around rules that are going to happen, even if the plan may still be uncertain in terms of timing, et cetera. Kristen, anything you would want to add to that, or other considerations you want to flag?
No, I appreciate the feedback, Kathy, and we have already started adjusting our notices to account for potential closures. But if there are any other creative ideas that folks might have, we definitely appreciate them. And you can feel free to send them directly to me.
Thank you. And Michelle, are you able to answer the question that Rachel has in the chat? Can you see that?
There's more than one.
The question was,
go ahead, Rachel.
can you offer some guidance and that children who are eligible for and receiving services, we are hearing from kids or families who are unable to access the single assessment because they're all backed up. so they're not getting services. And like that was rolled out in really what seemed like not a long period of time. So so this isn't about like anything really to do with the rule. It's kids who are actually eligible for things who are not getting services because they haven't had the assessment, because they can't get the assessment, because there's no one to give it to them for like a couple months. So if you would consider that, that would be really great.
Thanks, Rachel, for that.
I know in our case, the assessment that would call for, I started calling around as soon as I saw the proposed rulemaking. And for my 11-year-old, the wait list is 3 years long still. Just putting that out there. Like, if they want triannuals, we need to know that further ahead of time. Because it literally, as soon as you finish one, you need to get on the wait list for the next one.
I also just want to flag, I believe there might be a member of the media in this meeting. Well, this is a public meeting and is open to the public. I did just want to flag that if folks, it's not specifically a meeting for the media. So if you have questions, please do bring them to the DHHS press secretary, Lindsay Hams.
Thank you, Kathy, for that flag. And thank you for the feedback. And we will bring back, we're working very closely with the Office of Behavioral Health and the Commissioner's Office, as well as with Accenture around the single assessment process. So we will bring back the question about your concern, Rachel.
Thank you.
All right, I'm going to move on from that topic with my updates. I wanted to give an update around the Rural Health Transformation Program. Since we last met, I feel like I might have mentioned this last meeting, but in any case, Maine has received an award of $190 million for the first year of the Rural Health Transformation Program. I will note that it is a short year. The years of the RHTP align with federal fiscal year. And so this quote year just goes through the end of September. But we have been working very closely with CMS to finalize the terms of our work plan and our budget, and working out with them the timing of funds that will be received, whether or not some of those funds may be restricted until CMS receives more information. So that is actively happening right now. In the meantime, the department has been interviewing RHDP leadership positions and preparing contracts so that we are ready to get the dollars flowing as soon as possible. And that is the general update on that front. Moving ahead, just in the interest of time, and then I'll pause for questions on the different topics. Also wanted to give an update on our Health Pass upgrade. Health Pass is this is an upgrade to our trying not to use acronyms, so I'm stumbling, MMIS system, our Medicaid Management Information System, which is how we process all of our claims and interact with providers who are claiming, and there's also member functionality in that portal. So Molly Slutznick, our Chief Operating Officer, has previously shared with this group our upgrade to our system. We are still on track to complete that upgrade in September of 2026, so coming up pretty quickly this calendar year. And just as a reminder, some of the benefits to providers as well as members as part of that upgrade include that is going to be easier for providers to see information on member eligibility and benefits. Our online portal should be easier to navigate. There's going to be more options for submitting claims as well as more accurate claim adjudication. There's going to be improved data security, and there will also be an enhanced provider directory. So we expect that we'll be able to start offering provider and member training this summer. And that will be through a mix of online materials as well as live learning sessions. The upgrades to the online portal are going to result in some changes to how providers log in. And we plan to send the first e-message on this topic out in the next few weeks with instructions to help providers prepare. And my last update, you may have seen in the news or in social media that Dr. Oz, who is the head of CMCS, Centers for Medicaid and CHIP services under CMS, sent a letter to Governor Mills and to Commissioner Gagne-Holmes requesting information from the state regarding our practices within the MaineCare program related to program integrity and prevention of fraud, waste, and abuse. So we have been working very hard and collaboratively across the department to respond to that letter, which is due this Friday. And we intend to submit that response at this time. Right, questions on any of my updates?
I don't see any.
All right. Thanks again, everyone, for being here this week, and look forward to the rest of the meeting.
Thank you. And again, sorry for those who came late. My name is Kathy Killing Del Rio, and I chair the MAC, but my video is not working. I'm going to pass it over to Ian Yaffe from the Office of Family Independence for their updates.
Great. Good morning. Thanks for having me today. I think for a reminder for almost everybody on the MAC knows this, but a reminder that OFI handles the eligibility and enrollment side of MaineCare, and OMS handles benefits, as among other more complicated things, but that's what we're here for. So wanted to share a couple of updates on just where we're at operationally with MaineCare. And then I also just wanted to mention some of the things that are coming up in 2026 and 27, and when you should expect to hear more about that with some of the federal changes. So starting with operations, I think the last time that we met, we're talking about there being a seasonal influx to our work, both due to open enrollment with the marketplace and due to a higher than normal volume of SNAP applications that we received in the second half of 2026. We are now on the other side of that influx, and we've had 4+ weeks of steady backlog reduction time here. So that meaning that we've, generally speaking, processed more applications and renewals than we've received each of the weeks for the past several weeks, where I think for most of the fall we were above zero. We were, generally speaking, processing less applications and renewals than we received, which meant that the length of time for us to process things was increasing. So now that is going down. We still probably have another month or two until we get to what I would consider to be sort of normal processing time. So we're still slightly above average. And the good news is that we have lots of potential investments in that area in the governor's supplemental budget, so that we should be able to sustain that level of processing and bring wait times down even during seasonal influxes going forward. But without further ado, just kind of where we stand right now. As of last week, our MaineCare phone line was averaging 18 minutes for us to answer, and SNAP-related phone calls, including MaineCare questions that SNAP households have, were averaging 31 minutes. Both of those lines have the first in line sort of callback technology, so people can receive a callback instead of waiting on hold. And the times that I quoted are the average wait time for people waiting on hold. That doesn't mean that you may not have experienced a longer wait time than that. Those are just the averages. And I think certainly the time of day that people call relative to the volume of calls can really have a big difference in that wait time. But those are the averages that we have at the moment from last week. Generally speaking, we're needing the full 45 days to process MaineCare applications at the moment. And we're generally speaking needing the full 30 days to process SNAP or TANF related applications. Again, we're kind of stretched on those at the moment, but we'll be looking to bring those down here in the near future as we continue to reduce our backlog of applications and renewal related transactions on our side. We're also working to continue to make improvements to the call center technology. And I know that there's folks that have experienced issues, particularly in January and early February. So you should have seen some improvements there. But if you are continuing to work with MaineCare members, or if you're a MaineCare member yourself and you're having issues reaching us, when you do connect to one of our representatives, just let them know what you were experiencing, especially if it's a callback related issue, and what number you were using for callback so that we can troubleshoot what was going on. And we have a sort of active process to do that. So I hope, generally speaking, that things are on the improving side here. Especially compared to January, that things should feel a little bit better. And then just because I was looking at the data earlier today, I wanted to mention we changed a way that we do phone calls here over the summer, where now all calls are going direct to an eligibility specialist instead of having a clerical line where you would often talk to somebody pretty quickly, but they would often not be able to do whatever you were calling about, especially if you had something that wasn't like a general question, or you weren't looking for us to like mail you an application or something like that. And so when I was looking back at the data from last year, in the first half of the year, generally speaking, around 10,000 phone calls a month were actually getting to an eligibility specialist. We had many more calls than that were being received, but about 10,000 were getting to an eligibility specialist, whether it was for MaineCare, SNAP, or for TANF. And since we made our changes, about 20,000 calls on average a month are going to an eligibility specialist. So that's essentially 10,000 more people that are getting direct to an eligibility specialist the first time each month and not having to call us back in order to get through. Again, that doesn't mean that there's not challenges with wait times and things like that, which we continue to address. And the governor's supplemental budget should also be particularly helpful in us making sustained long-term improvement. But I think when you think back a year ago, we hope that you or the people that you're working with are seeing an improvement in at least getting through to that person that you need to speak to the first time on the phone, with a wait or without a wait with the callback technology. But still, that's our goal. So we're sort of excited to share that. And then in terms of some of the things that are coming forward, we have some contracted staff that are in training that are going to help us with reducing backlogs this year. We should start to see benefit of that next month. While those folks are primarily focused on SNAP, any effort that we take on SNAP generally brings benefit to MaineCare, not just for the half of MaineCare members that have SNAP, but also for the idea that it just helps us improve our overall processing and can help us focus work. We have several new positions that are proposed in the budget. Those really operationally speaking would bring improvement towards the end of 2026 once they're through training. But our contracted positions are meant to align with that so that you'd essentially see the long-term improvements this spring early, and then they would get sustained with the investments that are proposed in the budget. we're working very closely with OMS and with CMS on what exactly community engagement requirements are going to look like here in Maine. Those are the work requirements for expansion members in the most simple way that I can describe them, and just kind of wanted to remind folks that overall would expect that we'll have more clear information over the summer about, you know, what exactly these are going to mean and what steps folks should take. So at the moment, the most helpful advice that I have for members is to keep applying for and renewing coverage. And if people are wondering, you know, what can I do to make sure that I know what's going on, the most helpful thing is always to make sure that we have your updated contact information and that you read the letters that we send you or the notices that come through electronically. So that's just where we're at for planning on that. I know we're going to talk with some folks today about some of our goal around improving outreach and communication. So I won't. I'm looking forward to having some feedback here from members in that process, and just overall, thanks for your engagement in this. And we're looking forward to being in touch and doing everything we can to help make sure everybody knows what's going on through the changes that'll be happening. On the SNAP side of the house, most of the federal changes are most of the changes that have been made are effective already for SNAP. So there's, you know, generally speaking, the next round of changes will be for MaineCare, and those will not begin until at least the fall. So thank you.
Thank you, Ian. Maya, I think I saw your hand raised. Did you have a question?
Oh, sorry. That was an accidental hand raise.
No worries. And just wanting to notice that there is a comment saying that it seems like access has been easier recently. And just for Rhonda and others, I should have said this more clearly. Ian's role as director of OFI, and as you may know, but may not know, the reason we have OFI updates in this space is because they are the ones who deal with all the eligibility issues. So in some states, the services and eligibility are handled by the same part of a department, but in Maine, they're in two separate parts of the same bigger department. So that's why we want to have both of those. And yes, Office of Family Independence. Thank you, Sana. Any other questions? Okay, I know we're a little bit behind schedule. So Kayla, I'll pass it back to you for the next part of our agenda.
Okay, great. Thanks, Kathy. Before we dive in, I'm going to go over just a couple of housekeeping items for this next session. I had sent an email to state staff last week asking state staff to please feel free to log off the meeting at this point because we would like the next set of breakout rooms to be really focused on our MAC partners, the folks attending this meeting from outside of the state, so we can really hear your voices and your input on this topic. So thank you to the state folks, and we will see you all later. And then as we dive into this next topic, just a recap of what this is. The department has been working with Public Consulting Group, also called PCG, on a research project to inform our strategy for communicating about the federal budget reconciliation changes that are coming over the course of this year. So at this point in the research, PCG is going to host breakout rooms with all of you to get your input. And I'm going to pass the mic over to Sarah Gilbert to give an overview and an information setting intro. While Sarah does that, I'm going to be setting up the breakout rooms. And just so you all know, when I hit launch on the breakout rooms, you'll be placed automatically into rooms. And then I'll be manually assigning PCG folks to join you. So you'll be alone for just a minute or two until your host joins the meeting. And one last housekeeping item, PCG is going to be recording the breakout rooms. Those recordings will not be posted on the website with the rest of the MAC recording from today. So the website version of the summary of the MAC is going to be stopping now. And I will hand it over to Sarah.
Thanks, Kayla. Well, it's been